Have you ever taken off your socks in the evening and noticed deep marks pressed into your skin? Marks that stay there for several minutes? Or maybe your ankles feel so swollen that bending your foot becomes uncomfortable? Your shoes suddenly feel tight, your legs feel heavy, and by the end of the day, your ankles almost look puffy or enlarged. Now, I'm not talking about the mild swelling that happens after a long flight or a long car ride. I'm talking about the kind of swelling that seems to return every single evening. Heavy legs, tight skin, ankles that leave deep sock marks. If this sounds familiar, listen carefully, because persistent swelling in the ankles or lower legs is not just a comfort issue. Very often, it is a signal that your circulation is struggling. As we get older, the circulatory system becomes less efficient at pushing blood back up toward the heart. Inside the veins of your legs are tiny valves whose job is to move blood upward against gravity. But over time, those valves can weaken, and when they do, something called venous pooling begins to occur. Instead of flowing upward smoothly, blood starts collecting in the lower legs. Pressure builds inside the veins, and when that pressure becomes too high, fluid begins leaking out into the surrounding tissues. That's when swelling begins. Many people assume this is simply a normal part of aging, but the truth is something most people never hear about. Chronic swelling can actually slow circulation in the legs even further. And when blood flow becomes too sluggish, the risk of dangerous blood clots increases. These clots are known medically as deep vein thrombosis, or DVT, and if a clot travels to the lungs, it can become life-threatening. Now, before you become worried, let me reassure you. In most cases, swelling does not mean a clot is already present, but it does mean your circulatory system is asking for help. Unfortunately, most people rely on temporary solutions. They elevate their legs for a few minutes, they reduce salt, or they soak their feet in warm water. Those things may bring short-term relief, but they rarely address the real cause. The deeper issue is that the veins in the legs often become overstretched and sluggish, making it harder for them to push blood upward. And once that begins, gravity works against you every single day. But here's the encouraging news. There is a simple bedtime routine that can help support circulation, reduce fluid buildup, and strengthen your veins over time. Tonight, I'm going to walk you through 7 powerful nighttime strategies designed to help your legs recover while you sleep. Each step focuses on 3 key goals: helping fluid move out of the legs, improving blood circulation, supporting stronger, healthier veins. Many people who practice these habits consistently begin noticing their feet feel lighter, less swollen, and more flexible in the morning. And the best part? Most of these steps take only a few minutes before bed. But the final step, number 7, is something most people have never heard of. And it may be one of the most powerful ways to support vein health from the inside out. But before we get there, we need to start with something surprisingly simple. A step that helps your body begin releasing excess fluid even before you lie down. Let's start with step number 1 of the bedtime circulation reset. Before we start physically moving fluid out of the legs, we first need to prepare the body internally, because swelling in the legs is not always caused by too much salt. In fact, one of the most overlooked causes of fluid retention is often a mineral imbalance. Your body relies on 3 major electrolytes to regulate fluid movement: sodium, potassium, magnesium. Think of these minerals as a team that decides where water moves inside your body. Sodium tends to pull water outside the cells, while potassium pulls water back inside the cells where it belongs. Magnesium plays a different role. It helps relax the smooth muscles surrounding your blood vessels, allowing circulation to move more freely. But when this balance becomes disrupted, something that becomes increasingly common after the age of 50, the body can start holding on to fluid instead of releasing it. And that's when swelling in the feet and ankles often begins to appear. Many people make the mistake of simply cutting salt out of their diet. But salt alone is rarely the full problem. If potassium or magnesium levels are too low, the body may still continue retaining sodium and water. That's why the first step of this bedtime routine is something I call a gentle mineral reset. About 1 hour before bedtime, prepare a simple mineral drink. Start with magnesium citrate. Magnesium helps relax blood vessels and improve circulation. When blood vessels relax, fluid can move more easily through the veins and lymphatic system. Mix approximately 300 to 400 milligrams of magnesium citrate into a glass of water. Now here's the part many people don't know about. Add a small pinch, about 1/4 teaspoon of cream of tartar. Cream of tartar is actually a natural source of potassium. Potassium helps signal the body to release excess sodium and fluid. When potassium levels rise slightly, the body often begins letting go of trapped water that has been building up in tissues. Drink this mixture slowly about 60 minutes before bedtime. This timing is important. It allows your kidneys to begin processing excess fluid while you are still upright and moving, when gravity can help pull fluid out of the legs. If you wait until you are already lying down, the body has a harder time shifting that fluid. Now, I want to mention one important safety note. If you have kidney disease, heart conditions, or take medications that affect potassium levels, always speak with your doctor before increasing potassium intake. For most healthy adults, however, this small mineral boost may help support better overnight fluid balance. Think of this step as preparing the body's internal plumbing before we begin the physical techniques. Because once the body is ready internally, we can move to one of the fastest ways to stimulate circulation in the legs. It's a technique athletes and vascular specialists often use, and it works by forcing the veins to expand and contract like a pump. In the next step, I'll show you how to trigger this response using a simple hot and cold contrast method that can rapidly wake up sluggish circulation. And I'll be honest, this step can feel a little intense for about 60 seconds, but the circulatory benefits can be almost immediate. Now that we've prepared your body internally, it's time to activate something your veins desperately need: movement and pressure. One of the biggest reasons swelling develops in the legs is because blood simply stops moving efficiently. Gravity is constantly pulling blood downward toward your feet, and when the veins lose strength or elasticity, they struggle to push that blood back up toward the heart. Over time, the veins become stretched and sluggish. That's when fluid begins collecting in the ankles and lower legs. But there is a surprisingly effective way to help your veins wake up and start pumping again. It's called contrast therapy, and it works by exposing your blood vessels to alternating temperatures. When blood vessels encounter heat, they expand. This expansion allows more blood to flow into the area. When blood vessels encounter cold, they rapidly contract. That contraction squeezes blood out of the veins and pushes it back into circulation. By alternating warm and cold temperatures, you create a powerful pumping effect inside the blood vessels. Athletes have used this technique for decades to reduce swelling and improve circulation after intense workouts. But it can also be extremely helpful for people dealing with chronic ankle or foot swelling. Here's how to do it before bed. You will need 2 containers large enough to place both feet inside. Fill the first container with warm water, as warm as you can comfortably tolerate. Fill the second container with cold water, and, if possible, add a few handfuls of ice to make it very cold. Now begin the cycle. Start by placing both feet in the warm water for 3 minutes. During this time, your blood vessels begin widening and circulation increases. You may even notice the skin on your feet becoming slightly pink as blood flow improves. After 3 minutes, immediately move your feet into the ice-cold water for 1 minute. This is the challenging part. The cold causes the veins to contract quickly, pushing blood and trapped fluid back into the deeper circulation. Take slow, steady breaths during this step. The goal is simply to allow your body to experience the rapid temperature shift. After the cold minute finishes, return your feet to the warm water again for 3 minutes, then repeat the cold water for 1 minute. Continue this cycle 3 total times, and always finish with the cold water step. Why end with cold? Because when you remove your feet from cold water, the body naturally responds by sending a surge of fresh oxygen-rich blood into the area. Doctors call this a rebound circulation response, and that surge can help carry away fluid that was previously trapped in the lower legs. Many people notice their feet feel lighter, less tight, and more comfortable immediately afterward. But we're not finished yet, because even after the veins wake up, gravity is still working against you. To really drain fluid from the legs, we need to take advantage of something extremely powerful: elevation combined with muscle activation. In the next step, I'll show you a simple technique that uses your body's natural muscle pump to move fluid out of your legs in just a few minutes. It's one of the most effective things you can do right before getting into bed. Now that your circulation has been stimulated with the hot and cold method, we're going to take advantage of one of the most powerful forces affecting your legs every single day: gravity all day long. Gravity pulls blood and fluid downward, toward your feet. Your veins must constantly work against that force to return blood back up to the heart. When those veins become tired or weakened, fluid begins collecting in the lower legs. And that's exactly why swelling often becomes worse in the evening. But here's the good news. For a few minutes before bed, we can actually use gravity to our advantage. This next step helps drain fluid from your ankles by placing your legs above the level of your heart, while also activating your calf muscles. Your calf muscles are sometimes called the body's second heart, and for good reason. Inside the calves are deep veins that act like a pump. Every time those muscles contract, they squeeze the veins and push blood upward toward the heart. So when we combine leg elevation with muscle movement, we create a powerful drainage effect. Here's exactly how to do it. Find a clear wall in your bedroom or living room. Sit down on the floor with one side of your body close to the wall. Then gently lie down on your back and swing your legs upward so they rest vertically against the wall. Your body should form a relaxed L shape. Your back remains flat on the floor while your legs extend straight upward along the wall. Scoot your hips as close to the wall as feels comfortable. Even without movement, this position already helps blood begin flowing back toward the heart. But here is the key detail most people miss. You should not remain completely still. Every minute, we're going to activate the muscle pump inside your calves. Start by pointing your toes upward, toward the ceiling. Hold that stretch for about 5 seconds, then slowly flex your feet back, toward your face, and hold for another 5 seconds. This simple point and flex motion squeezes and releases the veins inside the calf muscles. And that squeezing action pushes trapped blood and fluid upward and out of the lower legs. Continue this movement about 10 times per minute. Do this for 5 full minutes. It may seem simple, but the effect can be surprisingly powerful. Many people actually feel the pressure in their legs slowly begin to fade during these few minutes. What's happening is that fluid stored around the ankles is being pushed back into the main circulation, where your body can properly process and eliminate it. Think of it as giving your circulatory system a manual reset before sleep. Once the 5 minutes are finished, slowly lower your legs back down. By this point, your veins are already functioning more efficiently, and much of the fluid that built up during the day has been moved out of the lower legs. But there is still one important question left to answer. Why did that fluid leak out of the blood vessels in the first place? In many cases, the answer lies in weak or inflamed capillaries. And in the next step, I'll show you a simple technique that helps strengthen the walls of those tiny blood vessels, so fluid is less likely to leak out and cause swelling again. At this point, we've already helped your body release some of the trapped fluid in your legs. The mineral drink helped support your internal fluid balance. The hot 10 cold contrast therapy stimulated circulation, and the leg elevation exercise helped drain fluid out of your ankles. But now we need to address something deeper. Why does the fluid leak out of the blood vessels in the first place? Inside your legs are millions of tiny blood vessels called capillaries. These microscopic vessels allow oxygen and nutrients to move from the bloodstream into surrounding tissues. But when capillary walls become weak, inflamed, or overly permeable, they begin allowing too much fluid to escape. That fluid then collects in the surrounding tissues, which is exactly what causes swelling in the feet and ankles. Over time, inflammation, poor circulation, and oxidative stress can make these vessels more fragile and porous. So the next step of our bedtime routine focuses on strengthening these vessels while improving circulation in the legs. We do this with a simple upward massage technique, combined with circulation-supporting oils. But before we begin, it's important to remember one key rule. Whenever you massage swollen legs, your strokes should always move upward toward the heart. This direction helps guide fluid back into circulation rather than pushing it deeper into the tissues. To prepare the massage oil, start with 1 tablespoon of a gentle carrier oil. Fractionated coconut oil or almond oil both work very well. Then add a few drops of essential oils known to support circulation. Cypress oil is especially helpful because it supports vein tone and may help reduce blood vessel permeability. Add about 5 drops. Next, add 5 drops of rosemary oil. Rosemary oil helps stimulate local circulation and encourages blood flow through the tissues. Once the oils are mixed, apply a small amount to your hands. Start by gently massaging your toes and the top of your feet. Use slow, steady strokes and gradually move upward, toward your ankles. From there, continue the massage up your calves. Focus especially on the lower portion of the calf muscles, because this area contains some of the most important veins responsible for returning blood to the heart. Use slow, firm upward strokes for several minutes. Avoid pressing directly behind the knee, where sensitive blood vessels and nerves are located. Instead, stop just below the knee joint. This massage helps in several ways. First, the gentle pressure helps push fluid out of the tissues and back into circulation. Second, the oils help stimulate local blood flow. And third, the anti-inflammatory compounds in these oils may help support healthier blood vessels over time. Many people notice their legs feel lighter, warmer, and more relaxed almost immediately after this massage. But there is still one final step we need before getting into bed. Because if we don't protect the progress we've just made, fluid can slowly begin returning overnight. In the next step, I'll show you a simple nighttime technique that helps maintain circulation while you sleep without restricting blood flow. And surprisingly, most people are using it the wrong way. By now, your legs have already gone through several powerful steps. You've supported your body internally with the mineral drink. You've stimulated circulation using contrast therapy. You've helped drain trapped fluid with leg elevation and the calf muscle pump. And you've strengthened circulation through a targeted upward massage. But here's something many people don't realize. Even after doing all of this, fluid can slowly begin returning overnight if the veins in your legs don't receive gentle support. And that's where the next step comes in. Light nighttime compression. Compression stockings are often recommended for circulation problems. But there's an important detail many people misunderstand. The strong medical compression stockings commonly prescribed for daytime use. usually rated 20 to 30 millimeters of mercury, should generally not be worn while sleeping unless specifically recommended by a physician. When you lie down, the pressure inside your blood vessels naturally changes. Wearing strong compression overnight can sometimes restrict circulation instead of improving it. What works best during sleep is light therapeutic compression. Look for socks rated around 8 to 15 millimeters of mercury. These are often sold as light circulation socks or travel compression socks. This level of compression provides a gentle squeeze that helps prevent fluid from pooling in the lower legs while still allowing healthy blood flow. Think of them as support for your veins while your body rests and recovers overnight. After completing your massage, simply slide the compression socks on before getting into bed. But there is one important detail to check. Look closely at the top band of the sock. If that band leaves a deep indentation in your skin, the socks are too tight. Compression should always be graduated, meaning slightly firmer at the ankle and gradually looser as it moves upward. If the top band squeezes too tightly, it can act almost like a tourniquet, restricting circulation rather than helping it. So choose socks that feel supportive but comfortable. Now, there is one more nighttime habit we need to correct. And surprisingly, it's something many people do every single night without thinking. Late-night hydration. Drinking a large amount of water right before bed might sound healthy, but in many cases it can actually make swelling worse. When you lie down, your body processes fluids differently. If you drink a large glass of water shortly before sleeping, that fluid doesn't immediately leave the body. Instead, gravity may allow some of it to settle in the lowest parts of the body, your feet and ankles. So the rule here is simple. Try to stop drinking large amounts of fluids about 3 hours before bedtime. If your bedtime is around 10 p.m., aim to finish most of your fluids by about 7 p.m. This allows your kidneys enough time to process and eliminate excess fluid while you are still upright. A small sip of water for medications or supplements is perfectly fine, but avoiding large drinks late in the evening can make a surprisingly noticeable difference in overnight swelling. At this point, we've supported circulation, drained fluid, strengthened the vessels, and protected the legs while you sleep. But there is still one final step, and this step focuses on something deeper: repairing the blood vessels themselves. In the final part, I'll show you a natural compound used in vascular research that may help strengthen veins from the inside out. We've now covered 6 powerful steps that help reduce swelling and improve circulation before bed. But the final step focuses on something even more important: long-term repair of your veins, because swelling in the legs rarely happens overnight. In most cases, it develops slowly over the years as veins gradually lose strength and the tiny valves inside them become less effective. These valves normally act like small one-way doors that keep blood moving upward, toward the heart. But when those valves weaken, blood begins moving more slowly through the legs, pressure builds inside the veins, and eventually fluid begins leaking out into the surrounding tissues. This condition is often referred to as chronic venous insufficiency. So the goal of our final step is to support the structure of your blood vessels from the inside out. There are 2 natural compounds that have been widely studied for this purpose. The first is horse chestnut seed extract. This botanical contains a compound called essin, which has been researched for its ability to support vein tone and reduce fluid leakage from capillaries. Essin appears to help veins maintain their structure, allowing blood to move more efficiently upward through the legs. Many vascular specialists recommend standardized extracts containing about 50 milligrams of essin. A typical supportive dose is around 300 milligrams of horse chestnut extract per day. The second compound often used alongside it is pine bark extract, sometimes called pycnogenol. This extract contains powerful antioxidants that help protect the collagen and connective tissue surrounding blood vessels. Healthy collagen is important because it helps veins remain strong and flexible. Some studies suggest pine bark extract may also support microcirculation, meaning blood flow through the smallest vessels in the body. A commonly used supportive dose is around 100 milligrams per day. Many people choose to take these supplements in the evening, when the body naturally shifts into repair and recovery mode during sleep. Of course, supplements should always be discussed with your healthcare provider, especially if you take medications or have existing health conditions. But supporting vascular health from the inside can often make a meaningful difference over time. Before we finish, there's one small habit worth mentioning because it can quietly undo much of your circulatory progress. Crossing your legs. When one leg is crossed tightly over the other, it compresses important blood vessels in the upper leg. That pressure can slow circulation and make it harder for blood to return to the heart. Instead, try to keep your legs relaxed and uncrossed when sitting. And if you sleep on your side, placing a small pillow between your knees can help keep your hips and legs aligned so circulation can flow more freely. So tonight, remember the full routine: the mineral balance drink, the hot and cold contrast therapy, the 5-minute leg elevation pump, the circulation massage. the light compression support, the evening fluid cutoff, and the vascular repair nutrients. These steps work together to support circulation, reduce swelling, and help your legs feel lighter and more comfortable in the morning. Often, it's the small habits we practice consistently that make the biggest difference. Your veins work hard for you every single day. Giving them a little support at night can help them do their job much better. And if you found this helpful, you may want to watch my next video where I explain 3 common foods that quietly damage blood vessels and worsen circulation after age 60. You might be eating one of them every single day.